All right, all right. Good morning, good afternoon, good evening. Depends on where you are connected from. My name is Emmanuel Adegbola, and I'm so excited to be on this show today. So today I'm not alone. We have titans and pillars of different fields that we'll be discussing our main topic for today. So I'm not going to, leak out the secret. So let them introduce themselves, and I'm going to be calling them one after another. Let me start all the way from Nigeria when the internet is still cooperating. So, if you don't mind, Dr. Bright, go ahead and introduce yourself to our audience.
Thank you, Dr. Emmanuel. Bright Ugochukwu is my name. I represent David Omenukor Foundation here in Nigeria. I'm so glad to be on the show. Thank you.
Awesome, awesome. So let me go to Dr. Adamu.
Yeah, hello, good evening, everyone. Good evening, viewers. My name is Dr. Adamu Al-Hassan Umar, and I'm the President and Chief Executive Officer of the Nigerian Cancer Society, the umbrella body of all cancer-related NGOs in Nigeria and in the diaspora. Thank you.
All right. Yayade, Laya Lau. So let's bring in Dr. Agrawal to introduce himself. Over to you, Doctor.
So I'm Dr. Ashwini Agrawal. I'm in practice in Dallas, Texas for a little over 22 years. Breast cancer is one of my largest patient population. Almost 20 to 25% of my practice is breast cancer. And thanks for doing this. And this is a breast cancer month. And this is a nice segue to get into this increased awareness for this breast cancer around the world. And thanks for doing this. Really appreciate it. And thanks for having me.
Awesome, awesome, awesome. So we also have Mr. Alex, my co-host, my able co-host. So go ahead and introduce yourself.
Yeah, my name is Alex Mahiri. I'm a co-host of this program and a facilitator of David Omenukor Foundation here in Nigeria. Thank you.
Awesome, awesome. And as you all know, and you will agree with me, that this show, there won't be anything called Kina Head Show. Someone else's dog is actually trying to also join us on this show. So if you could just do us well to put the dog away so that it will not scare other people away. Okay, so there won't be Kina Head Show without someone who really saw it that, okay, I think I need to extend my expertise to bring people together to share their knowledge. So while you are seated, join me with standing ovation as we welcome the host of this show, Dr. Kina.
Hello, everyone, and welcome to this episode of Kina Health Show. I am a family nurse practitioner here in Dallas, Texas, and we've been doing promoting cancer awareness for a very long time. This month, October, is a breast cancer awareness month. If you could recall, last year we did commemorate the program with giving away over 150 breast cancer screening right in the southeastern Nigeria. So this month, we're going to continue that effort. We want to screen over 1,000 women this time. And I will need your help. David Omenukor Foundation has been providing all sorts of screenings to people both here in the United States and in Nigeria. We carry out even blood pressure screening, diabetes screening, not just cancer screening, but we screen for prostate cancer, breast cancer, colorectal cancer. This month, we want to reach out to more indigenous women back in Nigeria so that they can get screened. On the show today, there is a young lady from northern Nigeria that is a survivor of breast cancer. And if we could hear her today so that she can share her experiences and how devastating cancer can be, especially for all these young ladies that are barely in their 20s and 30s. So welcome to the show. Stay tuned. I have experts here that are ready to answer your questions today. Thank you.
Awesome, awesome, awesome. And of course, unfortunately, Elizabeth has been having challenges connecting. Here she is again. I hope she's able to get through with us. So, Elizabeth, can you hear me?
Yes, I can hear you. Good evening. I'm
Awesome,
sorry I've been
awesome,
having
awesome.
a bit of a challenge.
Yeah, it's good to see you. Sonu
In
Sonu Yade.
Kaduna State at the moment.
Yeah, the internet is not cooperating, but we will get you through. We will not stop praying. Brethren, shall we begin to pray? We will begin to pray. Don't worry, you will come back. So I'm going to hand over to Mr. Alex, even as he, part of the keynote of this show today. Over to you, Mr. Alex.
Yeah, like Kina said, we are doing this program as part of the October Breast Cancer Week, and last year she recalled also what we did last year, and so it will be good for us to start. Dr. Agawa could give us a brief explanation of what breast cancer is and how it can be detected, just in a minute or two, so that we move into the refresh our minds and then get into the program proper.
Yes, so the breast cancer is like any other cancer, is uncontrolled growth of cells. And in this case, it is the breast tissue where there is an uncontrolled growth of cells in the breast tissue. And as most of you may be knowing, or the breast tissue has several components. There are lobules, then there are ducts, which are the like a milk ducts, the lobules where the milk is produced, and eventually it gets secreted. So any part of this, the whole ductal system, they can go into uncontrolled growth, and that leads to the breast cancer. And then we're going to go over a lot of risk factors that are associated with this. And then there are different kinds of these breast cancers. The ones that come out of the ducts, they are called infiltrating ductal cancer, which is one of the most common types of breast cancer. The ones that come out of the lobules of the breast, they're called lobular cancer. And then we have a mixed kind where we have a little bit of both infiltrating ductal as well as lobular cancer. So there are, I mean, it's a big, huge topic. We'll try to cover as much as possible. Some of the things I'll highlight: how to prevent it, and how to screen it, and how to briefly treat it and stage it.
Awesome, awesome, awesome. I see Elizabeth is with us again. So, Elizabeth, can you hear me? Elizabeth, can you hear me? Okay, we will not stop praying. We will keep praying. She will come back. Okay, back to you, Mr. Alex.
So, like the last speaker has said, Bright is like Pastor Adibola said, it's better to capture you people before the internet is still friendly. You are about starting a screening program from from Thursday, October 22nd. So how ready are you for this program?
Okay. Thank you very much, Mr. Alex. We are very much ready, and all is now set for David Omenukor Foundation to do it once more in 2021, come Friday, 22nd October this year. If we recall, earlier this year, we gave a highlight of how the foundation will function. And if we remember vividly, this is the second to the last program the foundation will conduct this year. Just a quick, a brief view of what we have done so far in our resilient fight against cancer. Over 120 men were screened for prostate on February 4th this year as we commemorate the World Cancer Day in line with UICC directives. David Omenukor Foundation championed that program and made sure that over 120 men we are screened for prostate. That did not end there. The program launched us to March, where we held World Colorectal Cancer Day, and fecal occult screening. We are also provided free of charge for the indigent men and women across the 27 local governments of Imo State. This is part of our resolve to fight cancer to a standstill, and part of the intent of the Chief Executive Officer to make sure that these preventable ailments did not capture our people in a hurry. We also had free reading glasses. We distributed free reading glasses to indigent men and women again in August this year, cutting across the southeastern states here in Nigeria. And here again, we are in a very special month of October, where we call the Pink October, where we are poised to at least have about up to 1,000 women will know their status come Friday, 22nd of October this year. We cannot do it except without, we cannot do it on our own, except with your donations and your support. And if you watch your screen right now, you can just go to the GoFundMe link and hit the donate button to be part of the program we are doing this week. Or if you are in Nigeria, you want to save a life, because here is very prone and we don't have the facilities here. You can get us at FCMB 606-717-9010, David Omenukor Foundation. If we also recall, by this time last year, we were on this type of program, as the Chief Executive Officer has said. Over 150 women were screened in this part of the country. I can authoritatively tell you that over 50% of the results on that screening were benign. More than 20% were given ultrasound, and the rest were referred to our oncologist for further investigations. So we cannot do it again without your support and without your donations. And we are saying that it is time we say we put a standstill to cancer with our donations and support. And that is why, if we can do it, all can do it. Thank you so much.
Awesome. Thank you so much for that briefing. What a good report. Anytime you're giving that report, I always forget myself. I just think I was just watching CNN reporting. Thank you so much. So, ladies and gentlemen, if either you are connected with us live or you are watching the recorded version, you should see a link right there. GoFundMe. You cannot travel to Nigeria to do screening, but your money can travel over there. Okay, you don't know whom's life you might be saving. So, Elizabeth, can you hear me now? Elizabeth, can you hear me? It's like that internet is not cooperating. Okay, let's come to Dr. Adamu. Over to you, Mr. Alex.
Yeah, Dr. Adamu, you have had Bright, the wonderful job they're doing there. And this brings us to the discussion we were just having with you. At this, you see, they're already working, and you are the president of the Nigerian Cancer Society. How do you come in, and how do you get government to support them at this stage?
Well, thank you very much, and thank you very much once again for having me on this show today. Before I delve into the discussion of the day, which is breast cancer, because we're in the month of October, Breast Cancer Awareness Month. The world is pink. So let me, at this point, appreciate the founder and the entire management of David Omenukor Foundation for all the laudable initiatives, for all the wonderful programs, for all the wonderful interventions they have been rendering to to humanity. Let me equally appreciate the very prompt, decisive, and purposeful response on the part of the founder of David Omenukor Cancer Foundation, On the plight of one of our patients, a 17-year-old here back home in Nigeria, whose story got to my attention through the Facebook post of a colleague that had issues with the surgery of an rectal tumor. The very night the news broke out, David Omenukor Foundation activated a mechanism when they learned I was going to visit the girl at the hospital. And Dr. Kina immediately made a pledge of 200,000 naira to be handed over to the patient. In fact, in less than 24 hours, the 200,000 naira was already in our hands, and we proceeded to deliver the said amount to the patient. I'm glad to inform the David Omenukor Foundation and viewers that the 17-year-old has had a successful surgery, and she is recuperating very well at the moment. And in addition to that, other good-meaning Nigerians, like the coordinator of Africa Health Budget Network, Dr. Aminu Garba Magashi, has taken care of the first 2 courses of our chemotherapy that she will start in like a week or 2 to come. So we thank you so much, and we truly appreciate the kind of interventions you do, regardless of creed, religion, tribe, or any other factor. We appreciate you for that. Coming back to the Breast Cancer Awareness Month, though for us in the Nigerian cancer space, and of course elsewhere, we consider October and any other month as a month to create awareness for all forms of cancer. Agreed, October is generally the Breast Cancer Awareness Month, but other cancers have also not forgotten at this moment. Like I said earlier, the momentum that has been generated over the past few weeks has been truly infectious. The grassroots interventions, the grassroots campaigns being undertaken by cancer advocates across the country and beyond has been quite spectacular. Like I stated yesterday in one of my posts, that Nigeria is green. I wanted to write another one that Africa is green. And of course, Africa is pink, and of course the world will be pink, because October, everywhere you go, wherever you touch, is one form of campaign on awareness creation, early detection for breast cancer in particular. As you can see, the very t-shirt I'm wearing, I'm still jogging, because yesterday we joined Medicaid Cancer Foundation to walk away cancer. And we walked away cancer, and we will continue to walk away cancer. In fact, as you can see, I'm still dressed to continue the work. So breast cancer in particular is being one of the most common cancers in women, generally, not only in Nigeria, but the world over, has actually constituted to be a great menace. And in Nigeria, for us here, particularly in areas where you have the majority of the populace, the rural areas, and in places like where I come from, areas like Yobe, Borno, and other states in that region, where the literacy level is very low, and of course the poverty rate is very high. And you have a lot of myths and misconceptions associated with cancers generally, not only breast cancer. And that has given rise to the late presentation, which is the compounding factor. And of course, late presentation in Nigeria means a great deal of negative to the affected individual, because you don't have the adequate facilities, you don't have the adequate healthcare personnel that can appropriately diagnose the type of cancer you have. So, but we are optimistic, and will continue to remain optimistic. You know, generally looking at Africa, when we talk about breast cancer in particular, you discover that out of the 3 top countries that are in the top 20 with the highest burden of breast cancer in Africa, Nigeria is one of them. Nigeria is number 2. Mauritius being the first, Nigeria being number 2, and of course, you have, I think, Egypt being the number 3. But interestingly here, you discover that despite the fact that Mauritius is number 1, the highest mortality rate, the number of deaths recorded due to breast cancer, is in Nigeria. It means that Nigeria is the worst of the three, despite the fact that Nigeria is second amongst the countries with the highest incidence rate for breast cancer. And that is the reason why we all need to come together. We all need to synergize. We all need to collaborate and ensure that we continue to sustain that momentum of awareness creation, engaging policymakers so that we can bring about the desired changes necessary in order to have adequate prevention and early presentation to the hospital. It will equally interest this House to know that these incidents in Nigeria, according to global cancer statistics, of over 26,000 cases, you have over 11,000 deaths, and that still betrays the fact that the indices, what is constituting all these, is the problems that are associated with their presentation. In Nigeria, a country where you have over 70% of the populace, paying for medical expenses out of pocket, is quite alarming. Where you have the national insurance scheme with a coverage of less than 10% of the populace. And when we talk about comprehensive cancer care, for affected individuals, we are talking about universal health coverage. Without universal health coverage, there is no way we can achieve maximum care for all cancer patients, particularly breast cancer patients, that is very common here in Nigeria, only second to cervical cancer. And this is a country where you have close to over 50% of the population living in rural areas. You have over 49% of the population living below the poverty line. So you see, sometimes prioritizing food to the table is number one rather than seeking for help. And that is the reason why we'll continue to make inroads. We'll continue to sustain the fight. We'll continue to advocate. It's a good thing that we are lucky that the Cancer Health Fund implementation that is about to start here in Nigeria covers breast cancer alongside cervical cancer and prostate cancer. And breast cancer equally. Yes,
I apologize. I have to interject to Doctor. I know. I mean, you can just go. Even the whole 1 hour, I can see that it's not even enough for you.
Thank you.
I mean, this is what to do anyway. Honestly speaking, I think you are too much, and we need people like you. Okay, in this particular country also to help. But thank you so much. You're still coming back anyway. But Elizabeth is trying to connect, but she's been having challenges connecting. So I'm going to just share what she sent to the host, and I want Dr. Kina to just take that up and read it, and why she talks about her.
Oh, so I met Elizabeth and on Facebook because she was promoting that everyone should have a day of not wearing a bra, because this is her own way of promoting Breast Cancer Awareness Month. She's a 31-year-old cancer patient. She's from Kaduna, a state in Nigeria. And I'm going to just read from what she sent. I noticed a lump in my right breast late 2019, which was ruled out as fibroadenoma until 2020 July, when the lump were increasing in size. And I went to another hospital and it was diagnosed to be cancer. I was diagnosed at stage 2, HER2+. I had 8 courses of chemo from September last 2020 to June 2021. I did a mastectomy in November 2020. Currently, I'm undergoing radiation at University College Hospital, Ibadan, but my primary hospital is Ahmadu Bello University Teaching Hospital, Zaria, Kaduna. So this young lady, even though she has this burden, she's still able to speak to the whole world. She's on Facebook promoting cancer awareness, especially this month of October, that we are celebrating Breast Cancer Awareness Month, so that we can reach wide, teach people how to do breast exams and other types of preventative care that individuals need to, steps that people need to take in order to make sure that they're not caught off guard. Whenever you notice a lump, always go to the doctor, get it evaluated, get a second opinion, get a third opinion. If you have to get a fourth opinion, get a fourth opinion. Thank you.
Awesome. Thank you so much for sharing that. And of course, even as Elizabeth is receiving medical treatment, we'll also be praying along with her, and I believe that she will overcome, and so with so many others that are in that same condition. Before we continue, we also have some testimonials from our David Omenukor Foundation from Nigeria. So I'm just going to be playing one of them while Mr. Alex take it away from me.
David Omenukor Foundation, promoting free cancer screenings.
ihe o jiri ụrọ ego na-anọ na nwaanyị ọ gwụchala. O nwere ihe ndị ọzọ na-adịgasị n'ahụ mmadụ nwere ike ime ihe akpụkpọla akpụ ya abụrụ ihe ọzọ. So nyocha dị mkpa n'ihi na ihe ndị ahụ chara na-awesị nwekwa mgbe ọ wesị dịka ọ na-adịrị nwaanyị. Ihe ndị ahụ ihe apụpụlata ofu ebe ya eme ihe ọzọ. O nwere ike ya wụrụzi ya ero ifuru. Ọ bụrụ ma mmadụ enweghị onwe ya ahụ ero ofu nsogbu na-anaghị eji na-aga ya hụrụ anya otu ebe a ego gbara ọchị anya nke like otu ọ dị ugbu a mmadụ nwere ike mụnwa adịla m n'ọrụ ana m arụkwa ọrụ n'ihi na erigo m oge a na-ejepụta so onye na-asụga onwekwe n'asị ụgwọ a na-eji asị mmadụ ezi onwe gị a na-enyema ya so mmadụ ọnwụ onwe ihe na-eme gị bọsị ihe ere omefu na ahụ mmadụ ọ na-eshi ọcha mgbe ọbụla ọwụ mgbe ahụ ọ bịara ka ọ na-abịa manifest dịka bekee si na-asị ya. So that ife ọ na-ezu ejikwa mgbe aga m eri ya a na-eri ya ejebe na-etete
Obi dị m ụtọ n'ihi na ịnụ ihe gbasara Mammogram na-ahụ ya, mana enweghị m echiche, ọ bịabeghị n'echiche nke esi ka m gaa mee ya maka na mma na ego nọ na ya iji mee ya. O nwere ndị nna anụ ofu mpaghara 25,000, ofu mpaghara nke ọzọ 25,000, nwekwa nke nna anụ 20 maka n'ihi ya onweghị m ego maọbụ iche m uche m ga-eji gaa ibe ya. Mana ugbu a m mụtara na David Omenukor Foundation eme ya n'efu na-anaghị ego ọbụla. M na-asị ka ndị a bidoro ihe a Chineke
Nwada anyanwụ oyi obi dị m ụtọ nke ukwuu. Echeghị m m ga-eme ihe a bet egbe emego m ji eme ya, mana Chineke akpọpụta David Omenukor Foundation ka o mere anyị ihe a n'efu na anyị ebe ọwụla. Chineke ga-agọzi ya.
I'm happy I'm getting it free. Something that is being done elsewhere with 5,000, 20,000, and this foundation is giving it to me free. I will never forget praying for them, families, everywhere they put their hands and with them. finish first. ụzọ ọma dibịa ịdị m mma n'ihi na ụlọ ihe a na-eche ugbu a ka m nwere ide test na-ekele Chineke na m nwere ike ime ihe a na-efu ka Chineke gọzie ndị kwadoro ọnọdụ a ahụ.
Awesome, awesome, awesome. I mean, we have a lot of them on David Omenukor Foundation's YouTube channel. You can just watch them and, of course, do us well also to share them. Okay, over to you, Mr. Alex. I see Dr. Agawa just enjoying himself right there. Where's my own lunch? That's right there.
Yeah, Dr. Agawa, let's get back to business. How do we detect breast cancer, and how do you think it is managed? How is you have been managing it? So if you detect, how do you manage?
So breast cancer, first thing is the diagnosis. Before I go to the management of the thing, I'd like to speak a word about the screening process. And the screening process has been very important. There are two reasons why the breast cancer mortality has gone down since 1970s, especially in the advanced countries. And two main reasons for that is screening and early detection of the breast cancer, and second thing is the adjuvant chemotherapy that has had to constantly this mortality of breast cancer is going down, and it has been proven in several large longitudinal studies that the breast cancer mortality has decreased by almost 50%, 47 to 50% on a 10 to 20 years basis. So I strongly recommend mammogram, but there are limitations for mammograms as well. The biggest limitation is about 15% of the breast cancer are mammographically negative. What that means, a mammogram comes back negative, that you can still have a breast cancer in 15% of the time. And another 30% of the time, the breast cancer is detected not by mammogram, it is detected in between two mammograms. Like generally in here, we recommend mammogram every year. So about 30% of these breast cancer are happening between the two mammograms. So what that means is about 45% of the patient, almost half of the patients are being discovered not by mammogram, but by other means. So I strongly recommend, very strongly, I cannot say that enough actually, the best screening process is a self breast exam. And when you are in the shower, when the women are in the shower or taking bath, that is the best time to examine the breast and see if there is anything abnormality they feel, or they even detect some abnormality in the shape of the breast tissue or the mammographic tissue. And if that is the case, they need to see their primary doctors. Another thing is when they come to a primary doctor like Dr. Kena, insist, especially the females, insist that they get a breast exam done. Okay, because these days, because of a lot of the primary care physicians, they are in kind of little bit of a rush that they have to see like lots of patients to make a living, even in US, that they are skipping some very important exams, and especially the breast exam for the women. So once they're coming to you, the breast exam, a thorough breast exam is a must, including examination of the axilla, examination of the lymph node in the supraclavicular lesion, and also a proper breast examination. That was prevent almost or detect early detection of almost 50% of these breast cancer, which are not otherwise seen with mammogram. So now, coming to the management part, this is a topic in itself for several hours. We'll try to summarize as much as I can. First thing in the breast cancer is the detection and the diagnosis. And the earlier the diagnosis, the better chance is that we have a chance of cure. So, like I said, depending on what stage you are diagnosed, the management differs. But the basic in stage 1 to 3, where the breast cancer is limited to the breast and it is highly curable, it is again highly curable from up to stage 3. That is the time we have to do everything. And the hallmark, the most important thing of this breast cancer in these early stages is surgery. Okay, surgery is the main component of these breast cancers, and then we have to adjuvant chemotherapy and hormone treatment after that. Now, in the stage one tumors, which is now, let me talk briefly about the staging of the tumor, and please stop me wherever or tell me when to stop because I can go on for another hour on this. But stage one tumor is a very early stage tumor. We define these tumors by TNM staging actually more accurately, which is T stands for tumor size, N for lymph node involvement, and M for metastasis. The tumor size is again T1 to T4, and if the tumor is less than 2 centimeter is T1, 2 to 5 centimeter is T2, more than 5 centimeter is T3, and then T4 is when it starts invading the chest wall or the skin. And the lymph nodes, N1 is when the lymph nodes are only in the axilla, and N2 is when the lymph nodes get fixed to the axilla, they're not movable, and N3 is when it's gone to the supraclavicular or other regions of the body, mainly locally. So N3, and MD is the metastasis. So once the tumor is in stage one, it is very curable. The treatment most of the time in the stage one, depending on the age again, is surgery followed by some kind of adjuvant treatment. Maybe they will not need, some of these women, they may not need adjuvant treatment like chemotherapy. They may just go for hormone treatment depending on the age. And then there are several other tumor markers we can do, several other tests to see whether the patients will benefit from chemotherapy or not. And one of these tests called Mammogram or Oncotype DX on the breast tissue, we can basically, what we are trying to do is limit the use of chemotherapy to the one who really need it, not everyone. In old days, like old age means 5 years ago, everyone came with breast cancer and everyone was getting chemotherapy and they would lose hair and they will become like me in few months. And but only this thing will grow back. But the thing is, it was very devastating for these women. So now we are with all these tests like Oncotype TX, Mammoprint, we are trying to define a very small group of patients who really need chemotherapy and will benefit from chemotherapy. Like this patient, Miss Virginia, who got chemotherapy, and in her case, the tumor was HER2 positive, and she will immensely benefit from this anti-Herceptin therapy, which will reduce the chance of recurrence very significantly. But what I didn't agree about management is, I'm not pointing fingers at anyone, but here we are doing less and less surgery. Most of these patients, they don't need mastectomy or taking out all the lymph nodes, which will give them comorbidities and morbid things or a swollen arm for rest of their life. So we are trying to limit the surgery to as little as possible, and most of the time it is a lumpectomy. And even the lymph nodes, we don't try to remove all the lymph nodes. Like I used to be a surgeon in India about 30 years ago, and I was doing mastectomies, and we were used to do like take out 50 lymph nodes, 40 lymph nodes from all the axilla, which is totally wrong. I mean, it is absolutely absurd these days. These days we do sentinel lymph nodes, a small one or two lymph nodes, and see if the cancer has gone to those lymph nodes, which predict that the cancer has probably gone to other lymph nodes as well. So we are trying to limit the surgery as much as possible so that the patients can still have a normal breast and the normal arm and no lymphedema through the rest of the life. So the surgery is getting more limited. Chemotherapy we are limiting as much as possible, getting more and more towards targeted treatment. And then we are very liberal in giving anti-estrogen therapy because most of these tumor breast cancer are being stimulated by the estrogens hormone, which is like a fertilizer for most of these breast tumors. Um, Once the cancer has gone past stage 3 and stage 4, most of the time, unless it's very limited, stage 4 means it has metastasized to only one or two spots. Most of the time, it is not curable. But even in stage 4, I have at least like 20, 30 patients stage 4 tumor. They are living fine and having good life here in America with the minimal intervention of either chemotherapy or targeted treatment. So even stage 4 tumor in breast cancer is not a death sentence anymore. You can live for a good life. I have a lady who started with a stage 4 widely metastatic disease when she was 73. Now at 83, she's still going on. And now she's probably not going to die of breast cancer. She has other conditions like heart problems that is going to overtake her. So even in stage 4 is not a death sentence anymore, and it is not curable, but you can live a very good health life for years and years. This is a very, very brief synopsis, but the thing is, it's a very wide topic. I didn't go into like all the kinds of targeted treatment we can do for breast cancer. Again, the most important thing to take from this is a mammogram is important, but it's not 100% self-breast exam. And when you go to a physician, please ask the physician to do the breast exam. Okay, don't get out. You're paid for that visit. Let the physician work on it and earn their money. Okay, when you pay $100, make the physician work. Don't just walk out without a gown. Tell them to put you on the gown, examine you. Okay, you spend another 15, 20 minutes. Okay, and self-breast examination. Don't just let them go free. It is like you go to a grocery store and you pay them $50 and come out without a bag. Okay, no, don't do that. Okay, you never do that when you go to a grocery store. You go $50 and you never walk out without a bag. Same way, when you go, tell the physician, no, I want the breast exam. I know you.
Very good point, Dr. Agrawal.
Thank you.
Yeah, Dr. Damu.
Very good.
Yes, sir.
I'm coming back to you because Dr. Agrawal has raised a number of critical issues of how this case is being handled here. And you know, we are operating on two environments in today's program, and you are representing the Nigerian environment from your vantage position as the president of the Nigerian Cancer Society. What is the situation in Nigeria? What are the challenges? What really are you people doing to see how many lives you can save? Back to you.
Yes, yes. Thank you very much. Thank you very much. I must actually salute Dr. Ashwani for the superb, hyper-concentrated knowledge he has impacted on the audience. Like he rightly said, these things he mentioned in 10, 20 minutes are things that he can spend hours talking about. And I'm happy he presented them in such a way that they will not be too scary for us. Bottom line, for us here in Nigeria, the presentation matters a lot when it comes to, you know, the outcome, positive outcomes for breast cancer and of course other forms of cancers. And it is very pertinent for audience to not hear that most cancers, about 60% of most cancers, can be cured if detected early. Now, that still buttress the fact that early detection is key when it comes to cure. Prevention being the ladder to early detection. Prevention. Prevention in medicine, they say, is better, cheaper, and safer than cure. And for us in the cancer advocacy space, the reason why we concentrate more on awareness creation, because awareness creation is what leads to early detection. First of all, to prevent and to have early detection so that there can be prompt treatment at very early stages. Now, in Nigeria, the situation is worsened, like I stated earlier, due to the lack of, you know, the 3 A's. The 3 A's, A number one being accessibility. Accessibility to health care. Availability of the infrastructure that is needed to make appropriate diagnosis. Then we talk about affordability. And with the way the healthcare system operates here, it will be very difficult to achieve the 3 A's in such a manner that there will be no problem. Because if you have access, you can't afford. If it is available, you can't afford. Why? Because there is no universal health coverage. And that is the reason why we'll continue to fight. We'll continue to talk around awareness creation. In environment like where I come from, forget about the poverty level and the illiteracy level over there. We have this illiteracy and poverty have compounded to form, you know, the very big challenge for patients to access care, especially patients that the local populace is thinking of having cancer. Because the myths and misconceptions associated with cancer in an environment like ours is very alarming. And this is the reason why we continue to propagate, we continue to increase awareness. There is a young lady from my state that is doing wonderfully well. She is a breast cancer survivor herself. Her name is Hadiza Aliyu Manga. She has an NGO after surviving breast cancer, and she is still living positively and doing very well. She has an NGO called Hadita Cancer Foundation that has been doing a lot. In fact, this week, this coming Saturday, in her modest way, something she has been doing over the years, she intends to embark on a cancer awareness walk to mark the Breast Cancer Awareness Month of October. And being a breast cancer survivor herself, a lot of people listens to her. And this is the kind of message we want to translate down to the grassroots. That is why in the Nigerian context, what the partner organizations to the Nigerian Cancer Society are doing at the level of the grassroots are very key component of what we advocate. These are the reasons why we continue to engage, and we are not going to stop. And like I said earlier, universal health coverage is what will eventually lead us to achieve that desired level of awareness and early detection that we desire. Come 25th of October this year, the biggest cancer gatherings in Nigeria, the 21st edition of the 2021 edition of the International Cancer Week. The primary target is universal health coverage because the theme is cancer care for all through strategic advocacy and investment. The reason why we chose this very particular theme where all stakeholders from all over Nigeria and beyond will gather is so as to continue to sustain and to propagate that call for universal health coverage for all forms of cancers, not only for healthcare generally, not only for cancers. And it is also equally important to note here that the nature, the attitude of Nigerians is something that we truly need to look at. And it's only awareness that can bring about these silent issues to the front burner. You know, the unhygienic way people are preparing food on the streets these days. You see people trying to fry meat by using old car tires. You know, you see people inhaling and eating carcinogens everywhere. So our health-seeking behavior is something that we really need to work on. As we continue to engage, as we continue to emphasize on the need for universal health coverage to government, as we continue to call on government to bring about appropriate policies that will better the lives of cancer survivors, because our intention, our primary aim is to see a world, a Nigeria, an Africa, and a world that is free of cancer. If that cannot be achievable, then we want to see a situation whereby fewer people will be affected by cancer, and then fewer people will die from cancer. And those that already have this disease, like our sister that is in this in this room here today from Kaduna, we want to have better, more qualitative life for those that are living with cancer. See the examples given by Dr. Agarwal about a woman that has basically been cured of cancer, that he has attested to the fact that is actually probably some other ailments, some other medical conditions that may be the reason why she will go, but not cancer. That is positive living, and we want to see a situation whereby that too is practicable here in Nigeria. Truly, the target is high, but we are aiming very high at the same time. And by the grace of God, it's not yet Uhuru, but we are getting somewhere.
Also, Mr. President, I mean, thank you so much for sharing. I know our time is fast spent, and I know a lot still needs to be covered. As you all know, that this month is Breast Cancer Awareness Month, and of course, David Omenukor Foundation is raising a fund, GoFundMe. Not really because they cannot do it on their own, but of course they need you to be able to do it. Okay, so that is why we have this GoFundMe going. So all you have to do is go to that link, gofund.com/, bit.me/E800C99E. And if you can't see it clearly, you can send a text message to either Mr. Alex or, of course, Dr. Kina. And remember, it's not only mandatory that that is the only link you can use. Some of you live in abroad, UK, United States, Australia, but you have all those Naira accounts seated in Nigeria doing nothing. You can use it to sponsor this. Okay, ₦1 million, 500,000, 200,000, we save a soul and save a life. So, and of course, just to let you know also that they accept cryptocurrency. So if they don't know how to convert, I can help to convert. So we accept Bitcoin, we accept Ethereum. If you have Dogecoin, we can accept. But so far, you have your key. Okay? So over to you, Mr. Alex, as we begin to tidy up gradually.
Yeah, Dr. Agua, you have already told us that a mammogram has its own limitations in terms of prevention of breast cancer. Apart from screening, what else would you advise as a way of minimizing breast cancer? How can we avoid it? What are the causes? What are the risk factors? What are those critical things you will advise everybody to avoid?
So right now, the biggest risk factor in America is obesity and fat consumption. This has been proven again and again that one of the reasons in the Western society the breast cancer is so high as compared to I mean, when I was practicing in India, I could barely see breast cancer, like maybe one patient a month or something. Here, I'm seeing almost every week couple patients. So one of the reasons is fat in the diet, which can be reduced. And then there was a very large study that was done out of Harvard, UCLA. One of my mentors did this study. What was the women initiative study, and what they prove is if the women here can exercise just 3 times a week on treadmill, half an hour, 3 times a week, they can reduce the breast cancer incidence by almost 25 to 30%. This kind of reduction, how we see this kind of reduction just by exercise was almost equivalent to taking tamoxifen, a pill for breast cancer reduction. So just exercising 3 times a week, half an hour on treadmill reduces the breast cancer. One of the most important thing I still promote and do is a self breast examination, because that is where you detect almost half of the breast cancer even before the mammogram, which has obviously some limitations. Okay. Then there are certain other risk factors which can be modified, cannot be modified, like the age of menarche. When you start menstruating, the younger the women they start menstruating, it looks like they have maybe slightly less chance of breast cancer. And the age at first child, the women who postpone the pregnancy till they complete their career work and they're in their 30s and 40s, there seem to be slightly higher incidence of breast cancer. I'm not saying that they need to modify anything, but this is just to be aware of. Maybe they need to get mammogram more often. I mean, or just do more self examination. But these are some of the risk factors. One of the risk factors that was very prevalent and that was we all thought that may be causing breast cancer, especially in Western society, is the hormone replacement therapy. Because all these postmenopausal women in America, they start getting these hormone replacement therapy for osteoporosis. And we thought that may be causing the incidence. But then there was a very large study from Denmark, which basically showed that hormone replacement therapy is not harmful and it is not increasing the incidence of breast cancer. So that is one of the myths I wanted to take away through this talk, that hormone replacement therapy in postmenopausal women is all right. It is not. It has not been shown, at least in last studies, to increase the risk of breast cancer. But if you get breast cancer, which is hormone positive, then the hormone replacement therapy needs to be stopped. Um, and these are some of the risk factors, but the most important, I would say, is exercise, and limit uh, uh, the fat intake as much as you can.
Also,
Dr. Adamu, you have anything to add from your own angle as we round up?
up by saying that the person that has the keys to activate bitcoins has told us that the Americans have millions over there, and they have millions lying in their Nigerian bank accounts that have not been using for years. Now, if you look back at the introduction of Elizabeth from the cancer victim from Kaduna, in that write-up by Dr. Kina, she said her primary health facility is Zaria, and she is having her radiotherapy in UCH Ibadan. Now, in Nigeria, currently, government is trying very well to see that patients have access to, cancer care under one roof. But that has not been possible over the years. As we are talking in this room here today, we have 6 radiotherapy machines that are government-owned in Nigeria in 6 hospitals. 3 are working, functional fully. 2 are ready and will soon be deployed. 1, I think, is only 1 that is not functional. Now, we have 1 operated on public-private partnership in National Hospital Abuja, and another one in UNTH Enugu. Now, a patient from my home state, Yobe, for example, if that patient requires radiotherapy, that patient will have to travel to Abuja to get radiotherapy before going back to Yobe or Maiduguri to have surgery and chemotherapy. Now, you are talking about a category that find it very difficult to even transport themselves to the hospital. And now, access to care is a major factor. So I will want to use this opportunity to call on those people that have the heart to invest, to come back home and set up standard health facilities that can cater for cancer patients and that can even give pro bono cancer care to patients, because no amount of money will be given to you that to compensate you for creating access and making healthcare available, particularly to our cancer patients.
And just to add to what you say, President, that
yes, sir,
you beg them to come back home, you also have to beg Nigerian government and Nigerian system to also make sure they protect them when they come.
We will continue to push. We will continue to push.
Okay. All right. So we have 3 minutes to go. It's been, I know, even 10 hours is not enough to discuss this topic. But of course, it's not how long we spend discussing, but it's how well. And of course, who is your neighbor? Who are you helping? I mean, it doesn't matter. You might not have a family member, a friend, or a relative that is being affected by the topic we are discussing, but you don't know tomorrow, okay? And of course, your money can go a long way in helping others, okay? And that is why David Omenukor Foundation is doing this GoFundMe. You can screen 1 person, you can screen 2 people, 10 people, and of course, even if they don't know your name, okay? God knows your name, and of course, He will compensate you for that. Okay, so let's begin to tidy up. We normally do what is called take home. So, I mean, maybe someone is just joining us or someone has been with us and you just want to, okay, all these things we've discussed today, this is what I want you to go home with. And I'm going to start with the president also. So, in 1 minute, what will you say a take home for our audience should be today?
Simple. It has been scientifically proven that prevention is better, safer, and cheaper than cure. And prevention is the ladder to early detection. If you have awareness to prevent, if you can't prevent, you lead to early detection. Early detected breast cancer is completely curable, as mentioned by Dr. Agrawal. So self-breast examination is key. The Medical Women Association of Nigeria has been doing extremely well in educating the populace, and they have branches the same way the NCS has branches in all the 36 states by creating flyers, pamphlets that will teach women in even local languages on how to do self-breast examination. Know you are normal. When abnormal is around, you will definitely know. Finally, universal health coverage is the way out. We want government to increase budget for health, to completely include cancer in national health coverage in Nigeria, the way you people are enjoying over there, so that our people will stop to die. So that
you are
so
the
that
one that
our
said it, President.
so that our patients can have access. As we sustain the momentum of awareness creation, patients will have access, there will be availability, and they can afford with universal health coverage. That's my take home.
Thank you so much. Before Dr. Agawa give us his own take home for us, there's also a question, and I believe that question also is directed to you by Choma Lewis. She says, besides walking on the treadmill, when you are talking about exercise, you made mention of treadmill. So she asked, what other type of physical exercise can be recommended together with your take home in 1 minute? Thank you. You are muted. You are muted. You can unmute yourself.
So thank you for this question. This is an excellent question. The reason I mentioned treadmill was because this is how we could do a controlled study and ask the women to go on a treadmill half an hour a day, but half an hour 3 times a week. But any exercise that raises your heart rate to a target heart rate of about 140 to 150 beats per minute. It could be running in the park. It could be just jogging, or it could be just some cardio with some weightlifting. Half an hour to 45 minutes, at least 3 times a week, is all that is needed to reduce the chance or incidence, according to the study, which was a very large study. I mean, it was almost like 20,000 women took part in the study. That it reduces the chance of breast cancer by 30%. And not only that, it reduces the chance, the people who had breast cancer, and once they have breast cancer, they have a high chance of getting another breast cancer either in the same breast or in the other breast. Even that chance was reduced by doing this exercise at least 3 times a week and reducing getting to your lean body weight as much as possible. What I think one of the reasons or the risk factors, which is very hard to prove, I think, is the fatty tissue or the fat, which is some kind of a carcinogen that causes or leads to this breast cancer. And one of the ways is the exercise. And I've seen this in one of the commonest causes of liver failure these days in America is not alcohol. It's not hepatitis C. It's not hepatitis B. It's what we call non-alcoholic steatohepatitis. Basically, fatty liver has become one of the commonest causes of liver failure and the commonest cause of hepatocellular carcinoma in America. So I think it's the same mechanism for other cancers, some of these other cancers, especially the breast cancer. So any exercise, not just treadmill, in the park, running half an hour, getting the heart rate to about 140, 150 for about half an hour, that is all is needed to reduce the chance of breast cancer. And I would strongly promote this. Actually, I have 2 daughters, 32 and 26. I mean, they don't get dinner till they exercise.
Wow.
I'm Hitler. I'm sorry, wrong word, but I'm very tough on that kind. No one gets dinner till they exercise at least half an hour, 40 minutes. Believe me. I'm very, very anal about it. That no one, that is the simplest thing to do. And it will improve your quality of life in so many other ways, just by exercise, which is free, which is, whether you're in Nigeria, you're in Sub-Sahara, wherever you are, exercise is free.
What is easy to do is also easy not to do.
I know. That's so true.
Thank you
Thank you so much for the question. It was
thank you so much. I think we've been on this show now for more than a year, if I'm not mistaken, and all what has been discussed, most of the times, over 99.9% of times, everything boils down to exercise, good diet, and what's the third one? Weight loss. Exercise, good diet, exercise, good diet, exercise, good diet. To do, and it's very free, as you said, very, very free. You don't even have to buy treadmill. But then what is easy to do is also easy not to do. Well, it's been an exciting moment. My name is Emmanuel Adigbola, co-host of this event today. And Mr. Alex, while you give your take home, what you have picked from today's show, then Dr. Kina will round it off. Over to you, Mr. Alex.
Yeah, I think the two speakers have already said it, but let me just add one thing I personally picked from today's show is that we need to give a lot of attention to self-breast examination. Thank you.
And I just wish we could demonstrate it on this show, but maybe when next we have the show. Okay, over to you, Dr. Kina.
Oh wow, what a wonderful show. I want to thank all you all our panelists who joined today, Dr. Damu from Nigeria, Dr. Agawal, as always. He has been here anytime we call on him or any cancer related topic, and all our audience from all over the world. It was a very wonderful show, and we couldn't exhaust all the questions that we had for today. One thing, like Dr. Emmanuel said over and over again, we've talked about preventive care and what do we need to do. Everything boils down to diet and exercise. Day in, day out, every day when we gather together here on this show, we're talking about how exercise and diet will prevent so many diseases. It will take care of your diabetes, it will take care of your obesity, it will take care of your high blood pressure, cancer, name it. So we need to continue to push and make sure that people are empowered. You know, when you go to the doctor, make sure you visit your doctor every year. And when you go, remember what Dr. Agarwal said, don't pay your money and walk away without getting breast exam. I know we're talking about breast cancer today, but the same thing for men, prostate exam. Demand it, is your right. You're paying for the visit. So know yourself, be charged of your own health, and do breast exam while you're in the shower once a month, and make sure you get your mammogram. With everything combined, diet and exercise, you'll be on your way to a healthy life. Thank you for another wonderful show.